Welcome to Breakfast with Spaniels with Dr. Judy Morgan. Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Morning, folks. It's a lovely Thursday. We had thunderstorms like nobody's business last night, and our dumb ponies stood out in it because, no good sense. They got nice and wet. They got poured on. Okay. On the news this morning, they had great pictures of lightning strikes on the big buildings and behind the Statue of Liberty in New York. Is pretty impressive. You might want to look for those online. So the title today is Ask Questions. And that doesn't mean ask me questions right now. This is not an ask me anything. It means, especially with the COVID practices and curbside going on with most veterinary practices and you not being able to go in with your pets, it becomes even more important to communicate really well about what is going on with your pet, what you're there for. We actually, we got this idea from another practice, but we put a form on our website where when you make an appointment, you can go download that form and answer all the questions that ask, what your pet's eating, any vomiting, diarrhea, coughing, sneezing, what they're coming in for, anything else you want addressed while they're there. It's just a list of questions to help us know what you want. Not very many people have gone in and filled it out on the website, but what's really nice is a lot of people are coming with a written list of this is what my concerns are. This is what my pet is due for or what I need or want. I'd like to have lab work done or the heartworm test, or I need refills on these medications. And so the more you can do to improve the communication process, because you're not going to be standing in front of the doctor most likely. Our technicians get on the phone when people pull in the parking lot and call in and say that they're there. Our technicians get on the phone, get the history, find out what you're there for, what the animal needs, whether they're sick or it's a well visit. And then when they go outside, there is a social distanced face-to-face because they have to go out and pick up the pet and clarify any questions. And then when the animal comes in, I'll do my physical exam, but before we do anything, like give any vaccines or draw blood or take x-rays, we communicate with the client again. Generally, it's the doctor communicating at that point, saying, look, this is what I found. This is what I recommend. Do I have your permission to do these things? Then we get them done. If you need an estimate, we give you that. Then you get those things done. And then the doctor should be back on the phone afterwards saying, okay, I took the x-ray. I found we've got a problem here and a problem here. This is my recommended course of treatment. Do you approve that? Not approve that? So there needs to be really good communication during this process. And it really hit me yesterday because I was doing a consultation with someone whose pet was sick. And so she took the pet to the veterinarian to get diagnostics done and find out what was causing the illness in the pet. What she didn't realize that while her sick pet was there, the veterinarian also gave 2 vaccinations. And so in the court, and this was a couple months ago, but in the course of the conversation, I said to her, I looked through the records from your veterinarian and everything looks pretty good. The diagnostics that were done, the recommendations that have been made. I said, except for the fact that your pet was given 2 vaccinations when it was there with an illness. And vaccines are only to be given to healthy animals. And I think if we use that logic, probably 90% of the animals that are walking in our office shouldn't be getting vaccinated at the time that they're getting vaccinated, or into veterinary offices. I won't say my office because we're very vaccine light. But and the client said to me, I had no idea that my pet was vaccinated that day. Nobody even told her. Now, I'm sure it was on her receipt. Maybe with the way things are right now, maybe they didn't even give her a written receipt that day. I have no idea. But she had no idea that her pet was vaccinated that day. And she said, I never would have okayed my pet to be vaccinated that day. My pet was sick that day. I said, your pet was sick that day. Your pet should not have been vaccinated that day. And then as we got more into it, it ends up her pet should never be given the 2 vaccines it was given anyway, because it has no exposure to the 2 diseases it was vaccinated for. And she said, oh, I didn't even realize that the dog was getting that. So make sure that you ask questions. Take a written list. And when the technician comes out to get your pet from the car, tell them, especially if you don't want vaccines or you don't want certain things done, tell them that as well as what you do want done. Because communication can sometimes be difficult in the office setting, even when you're inside. But with the way things are right now, I mean, honestly, I feel like when somebody comes to the clinic now and we're doing this curbside thing, we probably have at least 4 phone conversations with them. Like I almost just want to like open the window and have the people stand outside and scream through the window, and I'll scream through the window. I don't know. I don't know what the solution is here. But really important that you communicate well. So I would strongly recommend writing down an exact list of what your concerns are, what you want done. And if there are certain things that you do not want done, you might want to put that on there as well. If this pet that you're taking has not been seen at that office before, if your pet has any idiosyncrasies that they should know about, like he doesn't like to have his tail touched, or he's a little funny around his ears, or he really is challenging during a toenail trim. Any of those sorts of things, you need to let us know, because it's just a little more difficult. And it's interesting because a lot of owners are very nervous about sending their pets in without them. And I understand that. But I got to tell you, some of the dogs that have been difficult to work with in the past, when they don't have their owners there, they're really mellow. I think a lot of the breeds that are protective of their owners, when the owner isn't there and they don't have to worry about protecting the owner, they're very chill with us. It's kind of interesting. We do have a few patients that we have on there, don't do anything without the owner there, because some of them are we have a Schutzen German Shepherd that is, he would like to eat me, but he's very good with his owner, and she's a young woman. she's a tiny little thing, but man, this dog is really good with her. I can't see him without her being present because he will eat me. So I would say if you have a good relationship with your veterinarian and the technicians that work there, you should be very trusting about sending your pet into the building with them. Believe me, none of us go into this business to beat up anybody's animals. It's not our goal, and we just don't do that. But most of them are really quite good. And it was interesting. I read an article about it yesterday, and somebody said part of the reason the animals are much calmer in our offices right now is because there's less going on. You don't have a waiting room with 5 barking dogs and cats sitting in carriers around dogs. You don't have a lot of people and noise. Everything is just much more low key because there's just not as many moving parts. So we're actually finding the animals are much calmer than they've ever been coming in the office, which is, it's really interesting. And when I read that article, I thought, well, that makes a lot of sense because we're seeing the same thing. The animals are really chillaxed. I mean, they're just like, okay, fine, we're doing what we're doing. The new normal in some ways is working really well for them. So yeah, I mean, my staff is good. See, my cocker is better when I'm out of sight as well. He guards me. A lot of them do. We're finding that a lot. I have this little shih tzu type thing that maybe it's a cockapoo. I don't know, some little fluffy thing. It's an older woman, and man, that dog sits in her lap and just. So we have a note that she has to hand the dog to us butt first. So if she hands the butt toward us, we can take the dog and then leave the room with the dog, and the dog's a pleasant little angel. But when it is in her lap, or if we have it on the table and she's there, oh my gosh, it will kill us. So, and we figured that out really early on with that one, because the first time the dog went for me, she said, "Oh, he's never acted like that." I said, "I think he's protecting you." And we took him away, and that's what he was doing. So, okay. Everybody have a wonderful day. I got a busy day at work. Your cat had a UTI, sent a picture via text to my vet. He called in a prescription. Yeah. I mean, if you have a veterinarian that you have a good relationship with, I mean, I would still like to see a urine sample, but certainly, we're bending a lot of rules right now. Yeah, sometimes their humans create the issues. That is true too. Good for you, Marilyn. Crossing off the vaccines. Yep, hot human.